this short is an easy way to remember triangles of neck. So this black lines denote some anatomical landmarks which you need to know. This is the border of the mandible, hyoid bone, sternum and clavicle. Not anatomically accurate, but to remember. Okay, this is the mastoid process which is located behind your mandible, like behind your external ear. This muscle is the sternocleidomastoid, which divides your neck into anterior and posterior compartments. As I said, it is not anatomically accurate for you to remember. Okay, from here to scapula is the second muscle, which is known as the trapezius. This part will form your posterior triangle. So, this is the sternocleidomastoid. As you could see in this image, this projection is the sternocleidomastoid. Sternocleido is the clavicle, and mastoid, sternocleidomastoid. This muscle, along with the trapezius from the occipital bone to the scapula, together form the posterior triangle. The lower border is the clavicle. So this is the posterior triangle. Coming to the anterior triangle, you have a small muscle here. We'll see the compartments of the anterior triangle now. This whole space is the anterior triangle. So this muscle is the anterior belly of digastric, and this is the posterior belly of digastric. So this space will be obviously digastric triangle. Then you have omohyoid, inferior belly. Omo is the scapula, hyoid is the this part of the bone, hyoid bone. So it runs towards here. This is the inferior belly of the omohyoid muscle. So this will divide the posterior triangle into two parts known as the occipital triangle and the supraclavicular triangle. And this is the superior belly of omohyoid. It divides the remaining part of the anterior triangle into carotid triangle. This yellow part is the carotid triangle and this blue part is the muscular triangle. This small portion is the submental triangle. As you could see here, we also have an anterior belly of digastric in this quadrant, this segment, right? So together will form the submental triangle. This blue line is the imaginary midline of the neck. So this side also has the same anatomy. So you want to know more about the origin, insertion of the muscles involved and the contents of each triangle in a simple way? Comment S.